Hello, my name is Kim Quinn, and this is my Grand Rounds presentation for Foundations of Advanced Nursing Practice through Rasmussen University. I am a registered nurse in a small hospital. I hold two roles. I am the certified wound care nurse, and I'm also the vascular access specialist for the hospital. This particular case is one of a 32-year-old female. She had a pretty extensive medical history, some of which included hypertension, type 2 diabetes, short gut syndrome, and morbid obesity. And she actually presented to the hospital meeting sepsis criteria. I was initially consulted to see her as the wound care nurse because she did have skin breakdown to a couple of areas. She had a jejunostomy tube, a gastrostomy tube, an implanted port that she was getting TPN through at home, and she was having skin breakdown because her G-tube was leaking. So when I first went in to see the patient, very articulate, very well appearing, we sat down and had an extensive conversation about her history, about the tubes. The jejunostomy tube was not in use and had not been in use for quite a while. And she relayed to me that when she started to use it after placement, she just felt uncomfortable, didn't like the feeling of how it made her feel. She had cramping, stuff like that. So they went in and placed the G-tube, but she had refused to have the J-tube pulled. The G-tube she did use for her medications, some nutrition, but not all nutrition. And she was still eating actually 3 meals a day while she was here in the hospital for pleasure. She relayed that she allowed her children, fairly small, I think they were all under 10, to also administer through her J-tube as far as teaching and assisting her. And she did manipulate that G-tube quite a bit on her own, which is why it was leaking. The skin breakdown was not terrible, and I felt that it wasn't the cause of her sepsis. So she did have blood cultures drawn in the emergency room that came back positive. We came up with the treatment plan for her skin. I left the supplies at bedside because she did not want the nurses taking care of her. She wanted to do it herself. While she was in the hospital, she would only allow her medications to be put through the G-tube. She would not take them orally. And again, she was eating the whole time that she was here in the hospital with us. So I relayed my findings to the physicians that I did not feel that her skin breakdown was the cause of her sepsis. She had no other areas of skin breakdown at all, no other wounds. She was a type 2 diabetic also. So cultures were taken, surgery was consulted because the next step was to investigate to see if that implanted port was in fact infected. She did have nursing come to her home at least once a week, but all other times she was accessing her port herself for her TPN use. The area was slightly erythemic, but not raised, no rash, nothing like that. X-rays were done. It was in the proper place. Surgery did decide to get on board. They did remove that port and culture the tip, and it did come back as the source of infection. So she was given a line rest. I was then reconsulted in my IV role for another PICC placement. Her and I had discussed previously while I was in there with her doing her wound care, the reasoning for taking the port out and then possibly having another PICC placed. She did not want an external device because of the kids and being a single mom, and she just didn't feel lifestyle-wise it would be beneficial to her. So I went back and reconsulted surgery, but prior to reconsulting surgery, I did a pretty extensive history review of her because she had been in and out of several facilities. So the information that I was able to get through our system and look back in, she actually had bilateral subclavian DVTs, which took me a little bit to find, and brought it up to the physicians. So they did recheck. The DVTs were still present. And she also had a right bacillic DVT. So at that point, I was not comfortable with the risks that she would have had to been exposed to had I placed a PICC line at the bedside. We do not have an interventional radiology department, so there was nobody available to place a line for her under fluoroscopy. Surgery did not want to take her back for any other type of procedure, so it was ultimately decided that she be transferred to another hospital that had the IR and the fluoroscopy benefits for that. So prior to taking these classes and becoming a little bit more trained and on the path to my MSN, I'd never heard the nursing called the art and the science. I knew there was always like an art to it because of what we do, but I never really delved into my aspect of it and the true art that I kind of am involved in with my patients, because I do spend a lot of time with them. I do have multiple conversations with them. It allows me to try to gear their treatment plan better for them. It also gives me an opportunity to try to investigate cost-effective wound care for them, because not all insurances will pay for care, and a lot of my patients have a lot of financial issues, so we try to find more cost-effective alternatives. So I never really looked at what I do as an art of nursing, but with taking this class, I'm able to kind of delve into things and see that I'm able to spend a lot more time with my patient's bedside than, say, a med-surg nurse, because although I have a busy schedule and I have a lot of patients, I'm not on a time restraint. I can spend more time with them. The science part of it is the fact that I'm not sure that I would have really done the extensive background checking into this particular patient. There was a lot that she left out in her own personal description of her healthcare and lifestyle. So with doing the evidence-based practice and doing a little bit more research on how successful PICC lines are placed around blood clots, knowing my own comfort zone as far as feeling that her risks outweighed her benefits of me doing that bedside, allowed me to take a clearer view. I've always done evidence-based practice in my practices. I have a lot of conversations with our healthcare team and with our physicians and our surgeons as far as best practice for wound treatments or debridement and stuff like that. But this class has really kind of empowered me, so to speak, because now I'm a lot more confident when I am approaching those physicians and those surgeons on talking to them about best practices and what I have found in my research for best practice. Because there's still a lot of old school wound care ideas out there that have been shown not to be as beneficial. So I now kind of have the confidence and that stronger voice in speaking with them about it, and about my own limitations in what I view some of my skills may be. So I was able to advocate a lot stronger for this particular patient to be transferred to a proper facility, and having the proper guidance when having this other line placed. The other thing that it kind of allowed me to do is speak a little bit more confidently to the patient about the risks of having these extra lines that aren't being used, the benefits of going back and having them removed for her health care, risk of infection, things like that. So I feel that I did the best practice for this patient, and I'm hoping that she has the best outcome with being able to be transferred. And again, I just feel more confident in my practice, more empowered when I'm speaking to my other healthcare individuals, that we are a collaborative team, and I'm actually a strong part of that team. And this class has enabled me to do that a little bit better because I'm more confident in myself. Moving forward, I'm going to take that confidence and be able to teach also the students that I have that are interested in wound care. I teach IV specialty as far as using the ultrasound to place IVs and stuff. And now I know how to search for things and best practices and best ways to teach my patients, because now I can actually talk to them a little bit better and figure out their best learning practices, where I kind of don't think I did that before. So this class has really enabled me to grow, not only as an individual, but I feel as a nurse also. So thank you.